Bula Fiji, and a warm welcome to Speak Your Mind on Gold FM. I'm Louise Kaunisela. Every year on November, World Antibiotic Awareness Week aims to increase global awareness of antibiotic resistance and to encourage best practices among the general public, health workers and policymakers to avoid the further emergence and spread of antibiotic resistance. Since their discovery, antibiotics have served as the cornerstone of modern medicine. However, the persistent overuse and misuse of antibiotics in human and animal health have encouraged the emergence and spread of antibiotic resistance, which occurs when microbes such as bacteria become resistant. Fiji is commemorating right now as we speak World Antibiotic Awareness Week, and we have as my guest today in the studio the internal medicine specialist, infectious diseases from the CWM Hospital, Dr. Ravi Naidu, and we also have from the Consumer Council with us, Tevita. Welcome to the both of you to Speak Your Mind.
Thank you, Louise.
You're most welcome. Now we'll just get straight into it. Doctor, what is antimicrobial resistance and how do microbes and bacteria become resistant to antibiotics? I think I didn't say that right. Is it
Antimicrobials.
Okay. So I did say it right then.
That was good.
Okay.
Microbes are just tiny organisms. So we have bacteria, virus, and fungi, a few of them. So the most common organism that affects us is bacteria. So antimicrobial resistance is when the bacteria which causes disease becomes too strong in the sense that what medicine we give, the antibiotics, they don't work on them. So antibiotics are a group of medicine we take to kill bacteria which cause harm. There's a lot of bacteria which are good to us and naturally are on our skin, inside our gut. But there are some bacteria which is not good, so they cause disease. But whenever we take antibiotics, what happens is we kill off the weak bacteria which is susceptible to the antibiotics, and what we're left with is the stronger one which might survive in the next onslaught of antibiotics. So next time we give antibiotics, that stronger group will persist. So as time goes by, the more antibiotic pressure we put on these bacteria, they become more and more resistant. So what has happened is in the last decade, there's been hardly any, one or two new antibiotics. But the antibiotics were discovered sometimes in the 1940s by Alexander Fleming. And at that time, he said that this is a natural phenomena. It's for any living organism, if we put them under stress, they will try and become stronger. So bacteria is just naturally becoming stronger to the stress of us putting antibiotics to kill them off.
Oh, wow.
So they are getting stronger, but our choice of antibiotics are getting less. So that's why it's become a global crisis and also a national concern. So just to put it in perspective, in the World General Assembly in the UN, there's only 4 health topics which have been discussed ever. So one was Ebola. So everyone knows what Ebola is, deadly. One was the HIV epidemic. And the other one was the NCD epidemic and this AMR, antimicrobial resistant crisis.
So that's how serious it is. I mean, for the UN to take it on, that's something, that's a world, very concerning for the world. Yes, so like when you say, when you have antibiotic resistance, okay, just say for instance, what do you mean? So if someone has a bacterial infection, you prescribe them antibiotics and it's not working. That's basically what it is.
That's basically, in a nutshell, that's what it means. So somebody with a simple sore throat, if things continue 10, 20 years down the line, with what the streptococcus is the bacteria which causes sore throat. So if things continue as it is, 10, 20 years down the line, that sore throat might be a death sentence to that particular person if it gets out of hand.
Man, so, that's awful.
Before the antibiotics, people are dying of simple cuts, simple infections, which we can treat easily at the moment with antibiotics. But a lot of people have predicted the post-antibiotic era, which is similar to the pre-antibiotic. So before antibiotics came in play, it's looking, the future looks a bit bleak, as you'd like to say.
Yes, we'll talk about how we can make it not so bleak by, doing action as, people. But what is the Antibiotic Awareness Week and why is it important for our country? Well, I'm sure, we can figure it out from what you've said already, but yeah.
So the Antibiotic Awareness Week is an initiative started by WHO in 2015, where the whole world commemorates and takes a week out to promote antibiotic awareness. And since its inception, Fiji has been very actively participating. And so this year's theme is Stewards for Life, Stop Misuse of Antibiotics.
Okay.
So keeping in line with the theme, we just launched our antibiotic guidelines yesterday.
Okay.
So that's why the national response has been very active to combat this situation and to slow it down. So the people of Fiji have less burden of antimicrobial resistance.
Right. So what can the public do to help prevent antimicrobial resistance?
The public, I think we have my colleague from Consumer Council, which is very important. They play a big role in controlling antimicrobial resistance. It's not just the doctors or the ministry or the government, or it's everyone's responsibility. As such, the public can ask the doctor why are they prescribed antibiotics, and if they are not prescribed antibiotics, it doesn't mean that the doctor doesn't want you to get better. Most likely you might not need the antibiotics. So most of the times we have viral infections which get better by themselves, and where there is no need for any antibiotics. The home remedies such as lemon juice, rest, and a bit of Panadol to take away your fever should just support you while your immune system fights back. So the public plays a big role in this, just to be aware that antibiotics are precious and the use should be controlled as much as possible.
Thank you for that, Dr. Ravi on Speak Your Mind. We'll be back soon. Welcome back to Speak Your Mind on Gold FM, only the classic hits. I hope you're enjoying the program. This is really important. Make sure that you listen carefully to what Dr. Ravi is telling us about not misusing antibiotics. Some people, they just get a little bit sick. They reach out for antibiotics. So, doctor, you already said that you don't need antibiotics if it's a little viral infection, which you can make better by just doing some home remedies. Ginger, maybe, whatever, and using your own immune system. Is that right, to be able to fight against that virus?
Yes, that is correct, Luis. It's just, I say that with a bit of caution, because sometimes you may need to be given antibiotics. So if it's a common cold, flu, you have runny nose, a bit of fever, that might not need antibiotics, and you may know this, that you might not need to see a doctor even. But if you are sick, please, if you're not sure, just see your nearest health center or your nearest healthcare worker, and seek their advice.
Yeah, doctor, just one advice. How can you tell the difference between a bacterial infection, if, like, for instance, you're a doctor, and you will know whether to prescribe the antibiotic or not. So how do you make that diagnosis?
So there's a big process when a doctor sees you. They take a history, they take the story of what you're presenting with, and then they examine you. There are some key features in the history and the examination which point towards if it's bacterial or viral. So bacterial infections, patients are very sick. They will have very high fevers, and they might not be able to get out of bed, or sometimes these are just general rules, but it's a bit more complicated than this. So my advice still stands that if you're not feeling well, please see a doctor.
Okay.
And with the viral infections are usually more common, and usually you have running nose, red eyes,
The head cold,
yeah, the head cold. So there's many terms, but those are usually viral infections, and they don't require antibiotics. Having said that, if by day 3 you do not improve, it's always wise to seek medical advice.
Oh, thank you, doctor. That's good. At least we know by day 3 we haven't improved and we seem to be getting worse and worse and worse, then we definitely have to go back to the doctor.
Yeah.
Okay, that's good. Now, I understand that the National Antibiotic Guideline was released yesterday, as you've mentioned. Would you like to talk about the guidelines, why they were important for us, why they are important for us?
So the guidelines are very crucial to the healthcare worker, anyone, be it a doctor, a nurse, or anyone in the remote setting. It gives a guide which antibiotics to prescribe to patients. And this guide is based on Fiji's resources and Fiji's resistant patterns. That guideline was a collaborative effort of more than 40 experts, both locally and overseas. And we had international organizations such as WHO and Therapeutic Guidelines Australia who also collaborated with us.
Right.
So I think it's a good guidance for the people of Fiji, for prescribers and the patients. And the aim is to get the best outcome for our patients with the best antibiotics and to reduce inappropriate prescribing. So that's why it's a very important document to us.
So that needs to be really stuck to. But anyhow, antibiotic awareness seems to fall somewhat outside the scope of the Consumer Council of Fiji. Tevita, would you like to talk about why the Council feels it's important to get involved in the fight against antimicrobial resistance?
Sure. So the Consumer Council, we are part of the National Antimicrobial Resistance Committee, with a whole bunch of other stakeholders. Dr. Ravi here from health. We have members from agriculture, from biosecurity, and we just try to bring the consumer's perspective to this fight against antimicrobial resistance. And really, a lot of our advice to consumers, it really just underpins a lot of the stuff that the health professionals are telling our consumers. So maybe basically for the council, why we take a keen interest in AMR is because antibiotic resistance is not just a problem for the person with the infection; it's a problem for others, because some strains of resistant bacteria can pass on. So this leads to higher medical costs, prolonged hospital stays, and increased mortality rates. So it really just poses a major threat to public health. We try to just advise consumers, just to listen to your physicians, listen to what they say, their directions with when they give you advice on how to take antibiotics, to complete the full course of your antibiotics, and not just because you feel better you stop taking it.
Yeah, that's the thing, Tevita. A lot of people here I know for a fact that they take just a few of the antibiotics and they won't complete the course. So, I mean, it's very important. We can also ask Doctor, after you finish what you're saying, why it's important to complete the course.
Yeah, definitely. Dr. Ravi can explain further on just why it's important to complete your course and not just, as soon as you feel better, put them aside and maybe you try to use them later when you feel sick.
Yeah, exactly. Right. Go for it, Doctor. We need to know this because I know a lot of people are doing this.
So when a doctor prescribes you an antibiotic, it's usually for the course, be it 5 days, 7 days, 10 days. It depends on the disease you have. And the duration is usually based on the best evidence available to clear that particular infection. And when you don't complete the course, what happens is you have antibiotics lying around at home and people share antibiotics. This is not good practice. I think we should all stop sharing antibiotics and taking it for unnecessary things. And then disposing that antibiotic also poses some problem. Just throwing it in the rubbish, it leaches into the soil and promotes antimicrobial resistance in the natural bacteria which is in the soil and the rivers.
Okay.
And the bad thing is the bacteria, they share their resistance. So if they have a genetic portion which is resistant to a particular antibiotic, they have the capability of sharing it with other bacteria. So it's a very complex problem, and everything. That's why we're trying to tackle it with everyone from the agriculture to the Consumer Council to biosecurity. And
Yes.
health is just a small part of this big problem.
And it's really terrible because even for me, like in the 80s, when we used to get, a bacterial infection, we never used to get as sick as you do now. Like now, when you get an illness, it seems to be like really powerful. Maybe it's got to do with something with abusing the antibiotics, doctor.
Could be. It's hard to say, hard to comment on that. Yeah.
Okay.
Or could be we have just aged a bit. But,
Okay.
yeah, it does. Compared to the 80s till now, our resistance patterns have changed more drastically.
I reckon.
Yeah.
Thank you. Yes, I want to hear that. Yes, Tevita, and it's good to see that the Consumer Council is on board with this. But we'll get back to you soon on Speak Your Mind. Thank you so much, Dr. Ravi Naidu, for coming in to Speak Your Mind. And he is the Eternal Medicine Specialist of Infectious Disease at the CWM. Definitely have to have you back in here for a longer Talanoa session. On Speak Your Mind, we'll be back in a moment. Speak Your Mind on Gold FM, only the classic hits. And our guest today, well, we had Doctor with us, Dr. Ravi, but he's finished now, and I hope that you learned a lot from what he had to share with us on Antibiotic Awareness Week. This is also celebrated in the world. But now it's time to move on with consumer issues. And the Consumer Council of Fiji convened a panel discussion, and this was on Thursday, November 14th, with the theme Public Perceptions of Quality and Affordability in the Housing Sector, to provide a holistic look at issues found by stakeholders in the housing sector. Now, at the panel discussion, the Council released its research paper regarding real estate private rental sector. So what were the findings of the Council regarding Fiji's private rental sector, Tevita?
Yes, so the Council did convene a panel discussion just last week. As you mentioned, it was to look at some of the findings of research that the Council did into the private housing sector. Before I go into some of the key findings, but I'd like to talk about the panel discussion itself.
Sure.
So the panel discussion was convened just to hear from our stakeholders in the housing sector. We had representatives from the Real Estate Agents Licensing Board. You might remember Dr. Abdul Hassan. He was a guest with you once.
Yes.
We had the CEO of the Fijian Competition and Consumer Commission, Mr. Joel Abraham. We had speakers from FRCS, the Real Estate Agents Association. We even had USP students, because USP students, they have a interesting perspective on housing because of the issues that they face when they come to Suva to go to the university. So,
Yes.
quite a lot of injustice in that area as well. And also we had just academics from the university. So it's really interesting. The main objectives were to, like I mentioned, discuss the findings of the research and to create a platform to initiate discussions. So some recommendations that we had made from our research paper, they included, changes to the Real Estate Agents Act 2006.
Okay.
We also were trying to push for the Real Estate Agents Licensing Board to expand some of its functions. So some of our suggestions included they should be given the ability to discipline real estate agents. Currently the disciplinary action they take against registered real estate agents is that they remove their license.
Okay.
If they're bogus real estate agents, they report them to the police. That's one of their enforcement bodies. So we would like to see them perhaps have more powers to discipline real estate agents and have a sort of compensation to be able to be paid to whatever consumer has been affected. We also wanted implementation of minimum qualification requirements for real estate agents. So at the moment, you can basically anyone can become a real estate agents, and we wanted an amendment to the code of ethics. We wanted this to be actually put into the act.
Yes.
So the code of ethics will include a lot of things that real estate agents need to fulfill. They'll need to disclose the prices of the houses. and if they violate the code of ethics, then obviously their license gets removed. So
Right.
these were some of the things that we were pushing for in the research, and we also heard from our stakeholders. It was a very interesting discussion, and we'll now use the information to try and lobby for change in this private housing sector. Some of our other changes that we were asking for is to strengthen the advertising provisions. We've talked about this previously, where when a house is advertised, sometimes the pictures of the house, they don't show the pictures of the interior of the house. The price of the house is not actually listed. So, you're not quite sure what the commission is for the agent and what's the actual value of the house.
Right.
We wanted to provide provisions for false and misleading representation. So basically, if the advertisement is false and misleading, there's they can be taken to task. And also, we wanted a provision for regular inspection of rental properties.
Oh, yes, that would be just great. Yeah, I'd love that.
I'm sure you and a lot of listeners can relate. We'll have some horror stories with the rental properties we've either looked at or actually stayed in. The condition of the house itself is quite deplorable. So these are some of the things that we were pushing for. We also would like to see, perhaps we want to see the establishment of a one-stop shop for the real estate sector, for both a private rental sector and properties on sale. When I say one-stop shop, I'm talking about something like a website or a database where every single property that's put up for sale or put up for rent is listed, along with the price of the rent or the price of the property itself. You can have the price of properties surrounding the house that you're looking to buy, just so that you can compare the value of the house to the value of other properties in your that are close by.
Yes.
Just to make sure you're not paying exorbitantly more.
Yes, very good. I mean, very good things that you're trying to do and get implemented also, right? So when do you think this will all come into?
So we are. These are our recommendations. So we are trying to lobby for change now with the relevant government agencies. We'll continue to do this. We hope to see some change, hopefully in the near future. But it's just important that at least we have this research, and it's data that we can use actually to lobby.
Very important, because I mean it's the sector where you've noticed like it's getting really out of hand. I mean, people, bogus agents and not enough transparency.
Right.
So it's not clear for the person who wants to,
buy or rent.
I mean, they don't have a clear view of what they can do, how they can save. Yeah, I get what you're saying. That is really good. Now, did the council make any recommendations?
Yeah,
Please
sure.
explain.
So, yeah, definitely. So I've just been going through some of the recommendations that we made. The one-stop shop was one of them.
Right. Okay.
With the one-stop shop, it'll be very helpful because of the make it easier to monitor the rent freeze. We've spoken about this previously. How for residential properties, there's a rent freeze, the rent cannot be increased. So if the property is actually listed publicly in this database or website or wherever.
How do you do that again?
For the
to be listed. So
I mean, this is one of our
is that
recommendations.
the one like you said, but what about the stamp duty? One time you told me about last time.
Yeah, definitely.
I thought that was a good idea too.
Yeah, so the stamp duty, I mean, it already exists. There's a schedule for how much stamp duty you pay. If you pay a certain amount of rent, you pay the stamp duty directly to the FRCS. But for what we're talking about with the one-stop shop is we hope that if this recommendation is accepted, there can be a database or a website, like I mentioned, where you have every single property that's listed for rent there. So when the tenants change, the property is already listed for rent with the rental price that the previous tenant was paying. So and sometimes when the previous tenant vacates and the next tenant comes, and the rental price is increased.
Yeah, because there's no record.
Yeah, so it's very difficult to follow exactly. There's no record.
Very smart, the landlords these days. They try to sidestep all these things, don't they?
Yeah, I mean, definitely. But there are some bad landlords, but there are also good landlords. I just want to add that as well.
Yes, obviously there are good ones as well, but a lot haven't been very transparent about what they do. So that's why you're there, the consumer watchdog for us. So this is great news, what you're trying to do to help the consumer. Yes, and is there anything else that you'd like to cover in the real estate sector?
No, this is basically it. So we are.
It? Okay, so what about dodgy traders retailing bones as lamb neck pieces. Maybe we might like to talk about that.
Sure, yeah. So, that's an interesting case that we covered in the last 2 weeks, I believe it was. We found that a certain supermarket, this supermarket company in multiple outlets, so they were actually taking pieces of lamb, trimming the meat off and repackaging it for sale in the freezers, and then retailing the bones as actual, saying that it was lamb neck. Yeah, a number of distraught customers, they raised their concerns to the council about this practice. So we went on, out into the field. We conducted a survey in these supermarkets, and we found that they were actually justified in their complaints, the consumers. So
it's really good when the consumer is, very fast to pick out things like this.
Yeah, that's exactly it.
And that's how you find out.
Because during this time it's a high market activity, because coming close to the festive season, it's a time for getting together, so everybody's buying food, and sometimes consumers, they don't really look consider it carefully.
Yes.
They'll just see the advertisement and they immediately trust the supermarket that they're telling the truth.
Right.
So but these some of these consumers were very aware and responsible, and they were able to bring their complaints. So the council investigated. We found that the complaints were indeed valid. We got the bones removed, and we just like to give advice to consumers again. Just carefully consider everything you buy, and to traders, please adhere to all the guidelines regarding the sale of goods.
Yeah, I mean, goodness me, why would you want to sell bones as a lamb neck? Man, these people never think of us, do they? Okay, so you have obviously addressed it, like you've said, got rid of it to whatever supermarket it was.
Yes.
So that's all done and dusted.
Yeah, that's sorted. So, but we continue to advise consumers, because it is the festive season, and you'll obviously be out in the market.
Right.
Just please be aware, and if you do see any issues like the one I've just raised, call the Consumer Council, National Consumer Helpline 155.
That's free. 155. Make sure. Keep that number in your brain and report any little thing that you see that is not quite right. Gold FM, only the classic hits. This is Speak Your Mind. Stay with us. We'll be back shortly. Hello, Speak Your Mind on Gold FM, only the classic hits. We continue with our topic, and our guest from the Consumer Council of Fiji, Tevita Vuimbao. Now, Tevita, movie rating systems play an important aspect in advising consumers as to which target audience it's for. Now, in Fiji, we often take our children to watch movies in theaters, but forget about how the rating might affect them. I believe the council received complaints regarding children being charged adult ticket prices for some movies by cinemas. Could you please elaborate on this, Tevita?
Yes, thank you, Louise. Yes, so the council has received, as you correctly mentioned, complaints from parents. We dealt with this case within the last month as well. That a cinema was charging adult ticket prices to children for R13 movie. So, I mean, just the complaint was brought to the council by a concerned parent. So, movie ratings, they've been around since 1920.
Okay.
And they, of course, definitely you'll understand, being in broadcast, that, they allow the filmmakers to classify which movies are, what should I say? Suitable.
Yes, suitable.
Yeah,
whether
suitable.
For general or adults only.
Yeah. So
etc.
So G obviously means that the
General.
film, general exhibition. In Fiji, these are the ratings that we use.
Yes.
So in Fiji, all the movies that are viewed locally, they expected to go under the scrutiny of the Fiji Censor Board. So they basically give the ratings.
Okay.
And they may even override the existing rating that the movie comes with. They also regulate what is deemed suitable, for public viewing.
Okay.
This is, of course, mandated by law under they call it a cinematographic.
Yeah,
it's
that's
quite
a tricky
mouthful.
one. Yes,
Yeah.
yes, it is. I do the same with that one.
I was practicing this before the actual interview, and I just can't seem to get it right.
I know
Anyway.
it happens. We practice like mad, and then we think we got it, and then when we have to say it, and then okay, that's fine. Cinematography. There you go.
Yes.
So anyway, carry on.
Anyway, yeah. So G, obviously, general exhibition. Y is a film that is approved for exhibition to persons over the age of 13 years. And A, obviously, adults is adults only. While R shall mean that the film is approved for restricted public exhibition. Subject to conditions imposed by the censor.
Okay.
So what happened here in Fiji is we found that parents were visiting certain cinemas to purchase movie tickets for their family. They were told that the movie in question was rated R13. But if they wished to take, their child who's under the age of 13, they had to pay the adult price. So, some parents opted to pay the price and take their children to view the movie. And some concerned parents, obviously saw the act as, ethically irresponsible. They reported it to the council.
Good job. That's
Yeah, so
good.
good on them for doing that. So we sought clarification from the Fiji Censor Board, as I mentioned, because of their role in this area, and we were advised that under Section 13 of the Cinematographic, I got it.
Yay, good one.
Films Act. The cinema operators are restricted. They're actually restricted from exhibiting R13 movies to children under the age of 13. So if
So you're not even allowed to let
not even allowed to
children
let
under
exactly.
13. Holy.
Yeah. So obviously it's dishonest practice to sell the R13 movie tickets to children under the age of 13 at adult prices. So we obviously made a big hullabaloo about it because, like I mentioned, it's just unethical practice. So we called on cinema companies just to follow the ratings and procedures that are actually given by the Fiji Censor Board. Because the movies are rated by them, and so if no child should be permitted to purchase tickets for R-rated movies. In fact.
Yes.
And but while we're also urging cinema operators to abide by the law, consumers have a role to play as well. Yeah? We need to be responsible with our children. Maybe be a bit discerning about the content that we allow them to watch. Those cinema ratings are there for a reason. They're there because the film might have violence and other content that is just generally not suitable for children.
Yes.
So for consumers, if you do see this that film cinemas are selling tickets.
Right. Gold FM, only the classic hits. This is Speak Your Mind. Stay with us. We'll be back shortly. This is Speak Your Mind on Gold FM, only the classic hits. Thank you a lot for your company. My guest in the studio from the Consumer Council of Fiji, giving us a bit of advice on what we should be alert for in the upcoming holiday season, obviously, that we're having. So I spoke about students on their last week of school before they go into the 7 weeks holiday. So just basically asking you what advice the Consumer Council has for the public.
Yeah, sure, Louise. So during this time, just for parents, it's always a good idea to monitor what your children view. I understand that they'll obviously be going to the movies with their friends, but if you can, parental supervision is extremely important in public spaces such as cinemas. So consistently monitoring what they view in cinemas and then what they view at home as well. It just breeds good habits.
Yes.
And if you are unsure, you can even check the reviews for a certain movie that your child is going to watch, and you can make your own decision about whether you think it's suitable for your child.
Yeah, it's easy now. You have Google.
Yeah, you have Google, you have YouTube. You can watch everything.
The tip of your fingertips.
Definitely. For and just some more advice that we give is just just practice honesty. The state controls the rating of films and advertisements for public broadcast, and this ultimately determines who can and cannot view the film. If our parents are just allowing their children to purchase these tickets or are buying these tickets for their children, it's unethical. And also we just finally give advice to the traders, the cinema owners, cinema staff. For rated films, it's important that ticketing employees place these stringent measures to ensure no one younger than the restricted age is allowed to view movies. As I mentioned before, allowing younger children into these movies is an offense under Section 20 of the Cinematographic Film Act.
Yes. Okay. So what about consumers, going out for shopping, a lot of shopping, a lot of sales here and there, sometimes too good to be true. But yeah, Tevita, what would be your advice on shopping for the consumer?
Yeah, so definitely, Louis, Christmas season is a time for gift giving, and there's a lot, as I mentioned already, a lot of activity in the marketplace. Um, Before I go on to the advice, maybe I'll just talk about what the council is doing just to monitor the market during this time and how to keep consumers safe. What we're doing to
Okay.
keep consumers safe. So we're trying to just increase the frequency of our market surveillance. I mentioned, our market surveillance. We found out about the lamb neck sales. So during this time, we'll be, really focusing a lot on market surveillance just to make sure that traders are being honest with what they're advertising, that consumers are not being misled into buying products that are of substandard quality or that are expired. During this time, some traders know that unscrupulous traders know that consumers are really looking to get the best deals. So they will try and push out expired stock and hope that consumers don't check and just purchase it and take it home. So the Consumer Council will definitely have a very strong presence in the marketplace during this festive season and moving into the new year.
Okay.
We just advise consumers that while special deals, you obviously see so many advertisements saying, special,
Sale.
one time only. And while these are good opportunities for consumers to save money, there's also risk that you can spend your hard-earned cash. Some people have been saving the whole year to spend, money during this time.
Yes.
And so, there's that risk that you can lose all that money spending it on shoddy and substandard goods.
So what do you think the consumer should be aware of?
Right. So, I've got some advice. Just, some of the things that you should do before you actually go out. You should make a list.
Okay.
The best thing to do really is make a list and budget, and then avoid any last-minute shopping, because that way you get to take your time. You can consider carefully everything you want. You can do comparable shopping, which is check at one supermarket, maybe one item that's cheaper here is maybe they can sell at a better price at a different supermarket.
And that's so true, Tevita. You really need to do comparable shopping. I mean, sometimes people get lazy, but at the end of the day, it's a big saving that you make. I
Yeah.
mean, if you go to one supermarket, you can save $2, you can save $1, even $3 sometimes.
Definitely. And all those small savings, they add up eventually.
Absolutely, yeah.
Yeah. So
So make your list,
make a
budget.
and then try not to be swayed by these flashy advertisements. And if you do see an advertisement that is that's a deal that you absolutely have to have, maybe when you do go into the store, ask as many questions as you can.
Okay.
Make sure there's no hidden costs, especially for higher purchase deals or
okay.
during this time. So make sure there's no hidden costs. Ensure that
So when you say hidden costs, how do you find hidden costs?
Oh, just ask. The easiest thing to do is ask how much you will eventually pay if you're taking a hire purchase agreement.
Okay.
How much are you paying in total at the end of the agreement?
So you know exactly how much interest
Exactly.
you're paying.
Exactly.
So that's something to keep an eye out
That's
for.
definitely something to keep.
So okay, just say for instance, I took something out. Okay. Well, let's just make an example. A brush cutter.
Right.
So maybe it was. Let me just price it. Say $500. And then I want it on hire purchase. So what is an interest which is not too bad? Maybe 150 or...
Yeah, sure. I mean, really the interest that you pay on any item is, like you're saying, what's a good interest rate to pay? It's really according to the budget of the consumer.
Oh, yeah, okay. So that's how they calculate it. Yeah?
I mean, like for individual stores, I'm not quite sure how they calculate it, but for if you're a consumer, just look for the best deal. If the interest rate is too high, it's best just not to purchase it. Maybe it's best just to save up and try and buy it outright, if that is an option.
But then sometimes it's hard. People want things, and that's the only way they can get it on hire purchase because they don't have the cash.
Definitely.
Yeah, but I'm sure they must be. Well, they have to do their research, obviously, check which one's giving the best interest rate.
Yeah.
So maybe if I bought, just say what I was saying, a brush cutter for 500, and I paid off for a year, say for example, And if I'm paying $100 in interest, I don't really mind paying that $100. Do you think that's suitable?
Yeah,
Or is that too much?
It sounds suitable to me, but for other consumers who may not, for some other consumers, it might not be.
Yeah, exactly, because they might have less wages and less money, yes. Well, unfortunately, we've actually come to an end of the Speak Your Mind, but just some last words of advice before we head in to the festive season for the consumer.
Sure. Thank you, Louise. Just for consumers, during this time, I'd like to reiterate the advice I've given. Please be very careful with your shopping. If you do notice, do comparable shopping, make lists, do a budget. And we just like to give advice to consumers that during the festive season, that saying the best things in life are free is really true. The festive season is about, spending time with your family, spending time with your friends.
Man, that's so true.
The gift of company is a gift that you can give for free.
Yes.
So just be mindful of, the reason for the season. And, it's no use going broke now and, having further debts later on down the line.
So just,
true. Yeah.
That's just such great advice, Tevita. And, when I think about it, what you've said, it's so true. The best things in life are for free. And don't overspend. Why? I mean, geez, you're just going to blow it all out in one festive season. What about next year? What about going back to school and all that? But thank you very much, Tevita Vuimbao from the Consumer Council of Fiji. Hope you enjoyed the show today. Speak Your Mind on Gold FM, only the classic hits. We're your only classic hits radio station in the country. So keep listening to us for the best tunes.